we collect right here, and I just want to give this moment for anyone who has any last-minute burning questions. Please hand your index cards to one of the organizers. But the one question we have right now is posed to Wendy, and the question is, what healthcare policy is your organization currently working on, and what is the success rate of those policies that actually get passed?
Kind of a tough question there. As I mentioned at the beginning of my presentation, my organization, the Asian and Pacific Islander American Health Forum, is a national health policy organization. We work primarily on federal policy and then California state policy. Our policy work is really in 5 core areas. 1, increasing access to care, or access to insurance for Asian Americans, Native Hawaiians, and Pacific Islanders. 2, making sure that healthcare services are culturally and linguistically appropriate. As was mentioned in the video, I think it was Anthony who had to actually be an interpreter and translator for his family. All too often, children are asked to interpret for their parents who can't speak English, and sometimes they may not have the knowledge of these issues. So we want to make sure that we've got services that are available that are culturally and linguistically appropriate. Our 3rd area that we work under is workforce diversity, making sure that our healthcare worker population reflects the community it serves. Less than 1% of California's doctors are actually Southeast Asian or Samoan, and yet they make a sizable proportion of the California population. Another area we work in is improving data and collection and research efforts. All too often, Pacific Islanders and Asian Americans are either lumped together or just referred to as other. We are not other. We are not a dot. We are not a star. We are not an asterisk. We are not an other. So really looking more closely at getting some of that ethnic subgroup data as my presentation showed, and making sure that we recognize the diversity within our communities. The last policy priority area we work under is promoting community-based health. A lot of us in our communities don't trust Western medicine, and we want to make sure that our communities have access to community-based health services that really work for them and for them.
One question is, what are you doing so everyone participates in the 2010 census?
I'm going to go first and then you can chime in. But so actually Siren is a census partner. We're doing a lot of work, and I can't see Efraim here. Where's he at? He stepped out, but he's actually taking the lead on the census, our census campaign at Siren. We have been given some funding to do some precinct walkings. We're going to go door to door asking the community to please fill out the census forms. We've had already, just a couple weeks ago, we had a press conference in partnership with NALEO and other local organizations that are going to be, NALEO is the National Association
Latino elected officials.
It's a long name, and I don't know it, but thank you, Wendy. So it's a national organization, and they were actually, the director of NALEO was here at that press conference. We had a brief training for those of those volunteers that actually want to help us out. We're going to be doing a lot of phone banking, making sure, doing newspaper ads. We're also going to be sending out, sending messages through a rapid response to sort of try to encourage the community, one, to fill out the census form as soon as they get it in the mail, and then also to try to encourage the immigrant population to fill it out. We know that there's a lot of fear among the immigrant community because of all the rates and everything that's sort of been happening, but it's going to be definitely a challenge, but we are going to be working on that. Sorry, if you want to get involved, we need a lot of volunteers, so just contact me. I have applications for you to be helping us out.
So the Health Forum, we're actually a census information clearinghouse. On our website, you can actually access census data, and in the back, we actually have a data chart which lists demographic information for Asian American, Native Hawaiian, Pacific Islander populations across the 50 states, and there are a number of states that actually don't have data on certain indicators, which just goes to show that we need more and accurate census data. The Health Forum also actually translated the census survey into 5 Pacific Islander languages: Samoan, Tongan, Fijian, Chamorro, which is the language of folks from Guam, and I think one more that's escaping me right now. And so we're working a lot with our partners who are doing a lot of work in their communities to make sure that we get an accurate count.
So Efrain just actually walked in the room. We gave him our spiel. I don't know if there's anything you want to add specifically about census stuff.
Well, the census really is for the immigrant community a call to power. I'm sure they mentioned the funding part of it, and just to give you a stat, all of us are worth $20,000 to our community. Now what that means is if somebody's not counted, our communities here lose $2,000 every year for 10 years. That's $20,000 that we'll lose out on, which could go to education, which could go to roads, which could go to senior homes, which could go to just a number of institutions like this one, to help nonprofits and whatnot. So it's very important, and please fill out your census. If you guys have any questions, feel free to contact pretty much anyone here. I'm going to go ahead and pass some brochures, and